Hi all, this is your Endless Nurses World channel. போன வீடியோவில் நம்ம ப்ரீவியஸாக என்னென்ன இமேஜ் பேஸ்டு கொஷின்ஸ் கேட்பாங்க அப்படிங்கிறத பற்றி நம்ம பார்த்தோம். இந்த வீடியோவில் நம்ம என்னென்ன கொஷின்ஸ் வந்து கேட்கலாம், நாட் செட் கொஷின்ஸ் அப்படின்னு சொல்லிட்டு நம்ம பார்க்கலாம். First questions. While performing an endotracheal tube suction, the nurse observed that the client is having sudden severe tachycardia. Which of the following should be the immediate response of the nurse? Continue the suction, stop suction and perform reoxygenation, hyperoxygenate before suctioning, call the physician. The answer is stop suctioning and perform reoxygenation. Next question is, a nurse was giving instruction to a postpartum mother of a newborn with hyperbilirubinemia. Which of the following is an appropriate instruction? The options are withhold breastfeeding if phototherapy is continued, substitute breastfeeding with formula feeding, continuous breastfeeding every second hourly, routine supplementary feeds are recommended. Answers: continuous breastfeeding every second hourly. A pregnant woman visiting antenatal clinic complains that she gets frequent leg cramps and pain during night. Which of the following is an appropriate intervention to be suggested for the client? The options are dorsiflexion with knee extension exercise, complete bed rest is advised, use of compression stockings, all of the above. Answer is dorsiflexion with knee extension exercise. A 32-year-old male patient is admitted to an acute care psychiatric ward. The patient started showing aggressive tantrum. Which of the following actions by the nurse is a priority? Options are wait until the patient calms down on his own and administer sedatives SOS. Warn the patient not to do such aggressive act. Call for help to settle down situation. Answer is call for help to settle down situation. Next question is, which of the following drug causes red color urine? Options are streptomycin, rifampicin, ethambutol, isoniazid. Answer is rifampicin. A 65-year-old patient admitted in a long-term care facility has developed pressure ulcer. On assessment, the nurse found that the bone is visible and palpable on the wound site. The nurse knows that the stage of the pressure ulcer is stage 1, stage 2, stage 3, stage 4. The answer is stage 4. During postoperative care of an infant with a cleft palate repair, the nurse should position the baby in which of the following positions? Options are on side lying position, in an infant seat, prone, supine position. Answer is prone position. Cleft palate repair infant should be placed in a prone position. What is the color coding of the bag used in hospitals to dispose of human anatomical waste such as body parts? The options are red, black, yellow, blue. Answer is yellow. Anatomical waste yellow. Infected waste. The vaccine that forms blister and leaves permanent scar in babies is, options are DPT, BCG, measles, pentavalent. The answer is BCG. Next question. The pelvic shape that has the poorest prognosis from vaginal delivery is the options platypelloid, android, anthropoid, gynecoid. The answer is both platypelloid and android pelvis. Next is, which of the following colored IV cannula is used for infant? Gray, pink, yellow, green. The answer is yellow. Amputation that includes all levels of thigh amputations from the hip to the knee joint is known as transfemoral amputations, transtibial amputations, lower limb amputation, hip disarticulation amputation. Answer is transfemoral amputations. Therapeutic use of paracetamol is. Options are prevent nausea and vomiting, pain relief, motion sickness, all of the above. Answer is pain relief because therapeutic. Next is surgical complications that result from foreign materials such as surgical sponge or gauze piece accidentally left inside patient's body is known as. Options are surgical hemostatic syndrome, Gossypiboma, idiopathic necrosis, Gossypium hirsutum. The answer is Gossypiboma. Which of the following position is advised to relieve cord compression during labor? Options is supine, left lateral, slip Trendelenburg lithotomy. Answer is left lateral position. All of the following signs and symptoms are indicative of increased intracranial pressure in children, except. Options are nausea, vomiting, extreme irritability, decreased pulse pressure. The answer is decreased pulse pressure. What is the suction pressure applied while performing the endotracheal tube suction in an adult patient? Options are 40 to 60 mm Hg, 50 to 75, 60 to 100, 100 to 120 mm Hg. Answer is 100 to 120 mm Hg. Used nasogastric tube has to be discarded in yellow bag, red bag, blue bag, black bag. Answer is red bag. Plastic items should be in a red bag. Drug allergy is usually tested with an intradermal injection of small dose of a drug. Which of the following is the reason for using intradermal route for testing drug allergy? Slow absorption of drug, easy to administer the drug, less painful, all of the above. Slow absorption of drug. Thank you. These are all about some of the questions they will ask for exams. If you like this channel, you can subscribe to me and ring the bell button. You will receive my notifications. Thank you.